Hi, my name's Alex and I'll be your nurse. How are you doing, Libby?
I'm doing good.
What brought you in today?
Well, I was thinking, I sort of have a cold and my sinuses hurt, so I figured I'd come in.
Okay. Do you have any allergies that I should know about?
No.
Any past medical history that I should know about with you?
No, not.
Okay. Any family medical history I should know about? Cancers and anything else like that?
I know my grandmother had skin cancer, but...
Okay, skin cancer. What about, have you had any concussions with any sports or anything?
Yeah, I had a couple when I was younger because I used to play soccer.
Okay, did you go to the doctor for these?
No.
Okay, what about any other injuries?
Back injuries.
Okay, any surgeries?
Nope.
Okay, and do you have any aches and pains anywhere?
Just sort of my face.
Just where your issues
Yeah.
at? Okay, and how's your vision been? Has it been blurry, any halos anywhere?
No, it's been pretty clear, it's usual.
Okay, have you had any strokes or anybody in your family have any strokes before?
No.
Okay, and one last question, are you on any medications?
Oh yes, actually, I'm on Focalin for ADD, and I've been taking Mucinex to see if I can try to get any of the stuff out.
Okay, so now back to your chief complaint. When did you start having all these problems?
Like a week ago.
About a week ago? Okay, what makes it better or worse?
It's always worse when I get up in the morning. I feel but as the day goes on, it seems to get better and better.
Okay, and when is it really bad at?
Directly when I wake up, I feel I'm
How do you sleep at night?
laying down flat.
Laying down flat?
Yeah.
Maybe you should try to put some pillows under your bed.
Okay.
Okay, and then how do these symptoms affect your life?
It's I know it's not a major issue, but it's really annoying, and there's it's a whole constant pressure here, and I just don't want it to progress into something worse.
To something worse.
Yeah.
Can you point to me and show me where all of the pain is at?
It's there's a little here and some here. And
what does this pain feel like?
Someone a lot of pressure.
Pressure?
Yeah.
Okay, on a scale from 1 to 10, how bad is this pressure?
It's not really that bad. It's a 3, I think.
3?
But it's still annoying. It's
something that you want to get. You want to get all that gook out.
Yeah.
Okay.
Yes.
And is it constant, or has it just been for the past 2 weeks?
Just for the past
or a couple weeks.
Yeah.
And what do you think this is?
Probably sinus infection or cold.
Okay. Well, we're gonna start the assessment.
Okay.
Let me just grab this paper over here.
Cool.
Alright, I'm going to start with your head. I'm going to inspect it right now. I'm going to see if there's any lumps or bumps on there and for any lice, and just to see if your head is straight.
Okay, do you need me to see?
Yes, please.
Okay, go for it.
Seems perfect. No bumps or lumps right there.
Oh, nice.
So now I'm going to palpate your head.
Okay.
Can you keep your hair down just for a little bit?
Oh, yeah, sorry.
Alright, now I'm going to just check for some more bumps. Nothing's there. Alright, you can pull your hair back up.
Okay.
Now I'm going to check your temporal, which is your temporomandibular.
Yeah.
And then okay.
Good
I
job.
didn't need you too long to stand.
Okay.
Because I'm short. Okay. I need you to, I'm going to go like this. I need you to open and close your mouth for me.
Okay.
I'm going to listen for any clicking.
Don't let him. You feel it over?
Yeah. Alright, there's no clicks. So that's good. Alright, you can sit back down.
Okay.
Now I'm going to inspect your face. For your face, I'm going to check to see if there's any symmetry right there.
Uh-huh.
To see if it's even.
Okay.
So can you smile for me? And now can you frown? Okay, good. It's good. It's good. Okay, and now I just want to check to see if any of your eyebrows are higher than the other. Nope, they're even. Alright, now, have you ever experienced any involuntary movements before?
Sometimes when I'm really tired, my one eye twitches, but other than that.
Okay, is that a normal occurrence for you?
Yeah, it's usually just when I've stayed up for too late.
Okay, and now I'm going to check for any edema, so you don't have any big bulging eyes or no moon face, so that's good. Have you ever felt any swelling in your face before?
No.
Okay, and any lesions?
No.
There are no scars on your face. So that's good. So now I'm going to go on to inspecting your neck. So I'm going to look at your neck. Your neck is straight, so that's good. And now I'm going to palpate your neck to see if there's any lumps or anything. No lumps, so that's good. And now symmetry of your neck. Your neck is in line, it's even, not one side is higher than the other. Now I need you to I want to check your range of motion. Can you just move your head around in a circle for me? Does that hurt at all?
No.
Good. Okay, and now I'm going to check your lymph nodes. Good. None of them feel swollen. And then now I'm going to go on to your trachea just to see if it's straight. It seems to be in line and intact. And now your thyroid gland. So can you just stand up for me one more time?
Yep.
And I'm going to need you to place your head forward a little bit and tilt it to a side for me. And now swallow and take a deep breath. And swallow. And now do the other way. And again. Okay, thank you. Okay, and now we're just going to move on to now inspecting your nose, to where the issue seems to be at right now.
Oh, yeah, that sounds good. Sorry, I dropped your...
Oh, that's alright. Okay, so now for the nose, we're going to start with inspecting it just to see if it's in line. Your nose is straight, so that's good. And now I'm just going to check to see if there's any deformities in it, which means if there's any bumps or anything. No bumps, so that's good. Have you ever had any nose injuries?
No.
Good. Now I'm going to check your septum, so can you put your head back a little bit for me? It's even, so that's good. And now I'm going to see if there's any lesions anywhere. There's no lesions. And now I'm going to just check your patency, so can you please plug one side of your nostril and breathe in and out for me? It sounds really stuffy.
Yeah.
Can you do it to the other side? Okay. Would you like a tissue?
Yeah, that'd be great.
There you go.
Thanks.
Okay. Next I'm going to check your nasal cavity, which I'm going to check for color.
Okay.
The color of your nose should be pink. Inside of your nose, let me get this light. It's pink, but it looks to be a little swollen inside.
Yeah.
Now I'm going to check the integrity of your nose just to see if the structure inside of your nose is intact. No holes or anything. Perfectly good.
Good.
And now I'm going to check your turbinates, which are these little things right here inside your nose. And I'm going to check to see if they're swollen or bloody or anything. So can you tilt your head back all the way for me? This side, the left side of you seems to be a little bit more swollen than your right side.
That makes sense.
Okay. And now I'm going to palpate your nose. I'm going to do your external sinuses and then your sinus area. And just tell me if it hurts anywhere.
Oh. Yeah, that hurts.
It hurts right here?
Yeah.
Okay. I'll mark that down for you. Okay. And now I'm going to inspect your mouth, which I'm going to start with your lips just to see if they're chapped, bloody, dry, or anything. And they don't really seem to be dry, and they're pink, so that's normal. Have you been breathing out of your mouth at all?
A little. You know,
Okay.
My nose is like too stuffed up,
Okay. And they're not blue, so that's good. And now I'm going to check your teeth. They're good, they're intact, and they're not missing, and they're not rotten, so that's very good. And now I'm going to check your gums, see if they're bloody. See like this, and then pull this forward for me. Very good. They're not bloody, and there's no bumps, which are signs of cancer.
Cool.
Now I'm going to check your cranial nerve 12, so I need you to stick out your tongue for me, please. Great. And now I'm going to check your buccal mucosa. The inside of your cheek, what that means, the inside of your cheek should be shiny pink. Nice and shiny pink over there. And shiny and pink over there.
Cool.
Perfect. Now I'm going to check your palate, if you can stick your head back for me. That's also nice and shiny and pink. Now I'm going to check your cranial nerve 10, which is your uvula. So can you stick out your tongue and go, ah?
Perfect. It's going up and down. And your throat? Let me see. Perfect. And now I'm gonna grade your tonsils for you. Your tonsils seem to be 0, which is normal, and the highest that they can be is a 4, a +4, which means that your tonsils are touching, like your tongue and everything inside. So we don't want it to get to that. So I'm gonna send the doctor, and maybe he can get you some medication or something.
Cool.